Health is primary, and I think Kenya as a nation, we need to sit down more and consult more because I think primary health care in an environment where incomes are low and the standard of life for ordinary citizens, a big percentage of our people are living below the poverty line and just about $1 a day or less. So the provision of universal health care that is of reasonable quality and is accessible is essential in our situation. I think in countries like the United States of America and even Canada, that is a different world. They have superior facilities, even in terms of skills and professionals. They have more than we can ever imagine. So we learn lessons from them, and part of this partnership is to learn from them. This particular delegation is currently running a medical camp in Siaya Referral Hospital and Bondo Sub-County Hospital. And we are so glad that our friends and partners from Canada, they have been doing this over the years. They have gone to places in Central and South America, I believe, and in the Far East, in places like Fiji. But when we went to Canada, we had discussions, and they graciously are accepted to come to Siaya, to come to Kenya. And while here in Kenya, they have got very little time to see Siaya or see the rest of Kenya because they are busy in the hospitals carrying out procedures, mainly surgery, at both medical institutions. I am happy that they also accepted to come and see how our little kids are doing in this Siala Kadual. The responsibility of county governments in the field of education is essentially early childhood education. And all the centers, public ones that cater for little kids, are basically run by the counties. I am proud to say that in early childhood education, Siaya is the leader. We are in the Lake Region Economic Bloc. We are in charge and drive the education pillar. And many counties have come to benchmark with us here in Siaya. So we were quite excited when our visitors said they could come and see our kids. And part of this group, there's a group known as the Parallel Church. We had hoped that they would be part of the visit. We are into discussions when they would be able to do that. And one of the things that we did when we were in Canada was to see how they run nursery school, if you will. And in Bondo, we are doing what we are calling a model facility for early childhood education.
We started working on Monday, and we worked also yesterday. And even as we are here, two of their colleagues are in theater there, continuing to work, and we will work tomorrow and also Friday. We had lined up an average of at least 10 operations every day, and we have been achieving it. Because on the first day we did 12. We are doing these operations in 2 locations as had been stated. And yesterday also we did another lot. The total number of operations we have done are close to 45 as we speak in the two locations. They are mainly in the areas of general surgery, as Dr. Ryan Torrey has stated, and also in the area of obstetrics and gynecology. The visitors are helping us with some rare procedures, including bile stone operations to remove gallstones, and we are doing a whole range of other operations. In the areas of gynae, we are doing hysterectomies, and in the areas of general surgeries, we are doing a lot of herniorrhaphies, herniotomies, and laparotomies to correct intestinal obstructions.
As we go with the Tango Foundation, we go to different countries to help in any way that we can. And doing surgery, like we're mostly here with a surgery team, doing general surgery, helping with some vascular surgery, obstetrical work, gynecology surgery, but really we'll have more impact by helping children. If we can help in any way children to get a better education, have a desire to be a doctor, to be a lawyer, to be an anesthesiologist, an accountant, whatever, and see the impact that will have in the world. Helping do surgery on a few patients is fantastic, but even better is to help provide hope and encouragement and building brotherhood across the world. This was a long flight.
Yep.
It took about 32 hours or something to get to Saia County, but it was well worth it. Yeah. And we've never been received so warmly and wonderfully in any other country than we have here in Saia County, and we express our huge gratitude. It's a privilege to be here, and I hope that when you come to Canada that you'll come soon and come to my house. I grew up on a farm and a ranch, so I still have horses. We have hundreds of cows and fields, and we would love to welcome anyone that wants to come to Canada. But we appreciate the welcome. We appreciate you. Thank Governor Jim and First Lady Betty for the welcome here to your wonderful country.
We'd like to express our thanks to a visiting team of surgeons and doctors and nurses and the team from Tabor. We're very privileged as Saia County to have them for a whole week. We don't take it for granted. As you know, as the governor has said, Saia is leading in the area of early childhood education, and we are particularly concerned with the correct education and the right interventions in the first 1,000 days of a child's life. Our program here, dubbed Nyathi and Mwandu, takes account of all aspects of a child's development from conception to the age of about 3 years. And this is why we are particularly invested in ensuring good health, nurturing care for these children at this very early age. We are concerned too that we continue to inspire our young ones so that in days to come, I mean, we know that the impact of education is felt many, many years later, and it is experienced by communities. And for us, this is why we are doing this work. And we just want to say again, asanteni sana, thank you very much for coming to inspire our children at this particular location, but also for coming to do what you do best, which is to provide critical surgical interventions for which we are very grateful. So
No, you can use it. It's okay. It's wonderful to be here.
Nyalore Jim Kenga, Jim nyalore. Nera inga.
Of this school, just to introduce the staff and the people who make this amazing program work. So Chair Karibu, TA, who has joined us, and then we will know our visitors and then off to you. So, wawachoni program mondo umbe unae kaka wamor giweche matimore kae. Koro yena uru mondo aluong jakom kae, tumuono kata koro.
Yeah, yeah.
Jangan lupa.